Hi teams, for the mums out there, happy Mother's Day. I think it's appropriate that I have the chance to speak to you on Mother's Day because last week was the mother of all weeks for Community Pharmacy. I don't want you thinking that at CPS we don't know how you're feeling. From your feedback last week, the phone calls, the website inquiries yesterday and today, we know that you are tired, angry, frustrated, and for some, fearful. If you watched Matt's update from last night, you could see, hear, and feel those emotions from him. And that was after one shift, never mind a week. So we do get it. And me, Matt, Amanda, Adam, Michael, Emma, and Robbie, as well as all the other staff, are trying hard as we can to support you. Hopefully today gave you some time to recharge your batteries and get some downtime. And as I say that, I know that there were colleagues shouldering that burden yesterday and today over a difficult weekend. So here's a note of the new things, so as well as the ones we've updated you on earlier, that the CPS team will be going into fight for on your behalf tomorrow. Ensuring you're explicitly stated in Scottish Government guidance for critical workers, seeking clarification on the criteria for child schooling and care as it differs from England, get further ministerial recognition for what you're doing and experiencing out to the general public, ask that you be included in the opportunity to do your shopping at the same time as the NHS workers. Now, that will need us to be creative with our evidence for you to take in, as we don't carry NHS badges, but absolutely deliver essential services to the population. So I'd like to stay on the theme of the essential service I mentioned there. And I want to use an analogy to really illustrate this to you. If you think about the keystone of a bridge, it's that one stone at the top of the arch that if it's removed or it breaks, the whole bridge crumbles and comes falling down. Today, Community Pharmacy is, in my and others' opinion, the keystone of the Scottish NHS. Because if we can't supply medicines and keep that going, all the usually controlled disease states will need assessment and hospital care, and they will then block the hospital beds that undoubtedly are going to be needed in the coming weeks. And metaphorically, the bridge, the NHS, falls down. Now, you may or may not have been keeping up with Jason Leach, the National Clinical Director for Scotland, and thanks, Jason, for the shout out to the network on BBC Breakfast this morning, who was saying that he has many difficult asks for the people and country at present about staying at home, social distancing, no hugs for many mums today. Well, similarly, I have a difficult ask of you and our network tonight. And that's to grit our teeth and go again tomorrow, despite how we are all feeling, because we have to keep the medicine supply chain going, to keep the bridge standing. Now, I know pharmacists and our pharmacy teams do much more than this. It's just that at this precise time, it's the number one thing we must focus on. And fortunately for Scotland, we're great at it. You're probably there sitting thinking, how do we do that? My answer to that is, whatever it takes. Reduced hours, and we've heard that it is working well, and for our larger group pharmacies, I'm sure head offices will be advising on their model to you to allow you to do that. If you need to put people on the doors for controlled entry, do so. The immediate future of MDS and supervision, you'll need to give serious thought to whether you can maintain this, if you haven't already done so. Workforce, due to the changes over the weekend, there may be a group of people to tap into who are used to working with the public and temporarily could help us. Now, I know colleagues are setting up a website to encourage volunteers to come forward and be matched to pharmacy need. I would use that. So, whatever it takes. I'm now away to get ready for a video conference call with the chair of the Scottish General Practitioners Committee. Now, we used to be friends, and we'll see if we still are after it. Now, Matt trumped me last night with a great ending to his post. And I've no cute kids or pets to roll out in front of you. In fact, I can't even promise you tablet, because if I went and bought 1,250 bags of sugar, 820 cans of condensed milk, I'd get arrested for stockpiling. Mind you, some of you will be thinking that might be a good idea. But anyway, thanks again for all that you're doing. Stay strong, and we'll be back in touch tomorrow.